Estás viendo Canal América, televisión dominicana para el mundo.
Time for Truth Show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to a Time for Truth show. It's a pleasure to be back with you again tonight. I'm your host, Dr. Bernard Fialkoff. And before we get on with the show, I want to answer a question that many have asked is, how do I avail myself of all the previous episodes? It's very simple. Go on YouTube, A Time for Truth show, click on the subscribe button. We'll be happy to have you as one of our subscribers, members. There's no fee, and the whole purpose is getting truth out into our world, and the more that we have, the more that's going to occur. And tonight, we have one of those special leaders that we have in this space and in this time who actually delivers more than the conventional, goes beyond the norm, and it delivers an excellence and a level that allows his patients that he treats to experience a different health, a different care. And that's Dr. Paul O'Malley. And Engineer Buddha, let's put up his pictures on the screen as I describe this internationally trained dentist who specializes in biomimetic and holistic dentistry, with more than 25 years of experience transforming smiles through minimally invasive care. I love that, minimally. He earned his mastership in biomimetic dentistry from the Aleman Center for Biomimetic Dentistry in Utah, and further advanced his expertise through specialized international training in Italy. For over 2 decades, he has been an active member of the International Academy of Oral Medicine and Toxicology, a leading organization promoting safe, biocompatible dental practices. Dr. O'Malley is also a fellow and current vice president of the Academy of Biomimetic Dentistry, US, where he helps advance the science and practice of tooth-conserving dentistry. Throughout his career, he has completed hundreds of full mouth reconstructions and delivered over tens of thousands of veneers, mastering advanced techniques for ultra-thin, natural-looking restorations. His philosophy emphasizes careful planning, precision, and artistry in delivering results that range from subtle, lifelike smiles to dramatic Hollywood transformations. Earlier in his career, Dr. O'Malley operated some of the largest dental clinics in western Texas and eastern New Mexico before he relocated with his family to California in 2000. He later appeared as a featured dentist on TLC's hit makeover series, 10 Years Younger, showcasing his ability to transform smiles on national television. Beyond his clinical practice, Dr. O'Malley is an author, patent holder, founder of Great Oral Health, a Los Angeles-based oral care company whose probiotic, nanohydroapatite, and natural-based products have helped hundreds of thousands of people across the globe. He is also recognized for his expertise in the safe removal of mercury using the IAOMI's SMART protocol, and also for restoring teeth in ways that prevent cracks and future fractures. He's driven by a passion for both health and aesthetics, and is dedicated to helping his patients achieve smiles that not only are beautiful, but strong, long-lasting, and biocompatible. And Buddha, if you will, let's bring him up live on the screen and bid a warm welcome to Dr. Paul O'Malley to A Time for Truth show. Welcome, Dr. O'Malley.
Thank you. Thank you. Wow, what an introduction. I'm overjoyed to hear all those things, and I just realized, wow, you and I, we've been practicing for a long time, and it's been a great joy for me to help so many people around the world, not only with my great oral health company, but also people that come to see me from different areas around the globe, and of course in the greater Los Angeles area. So thank you for that. What a lovely introduction. Thank you.
You made it very easy for me, so you're quite welcome. So let's get right to it, because I know you have a lot to share, and I know a lot of people are going to be very curious. What were your dreams and goals when you were a young man?
Well, when I was a youngster, I always wanted to help people. That was my main core idea that I had. And so as I grew from maybe age 5, 6, 7, 8, obviously I wanted to be a doctor of some sort. I felt like I had capacity to help heal people, a healer, if you will. You're in the same profession, so you probably resonate with that.
Absolutely.
And I enjoyed watching the TV shows that had the doctors on there, like Marcus Welby, MD, to some of our older audience out there. But this man cared so much about his patients, per the TV show, and he'd go home and he'd sit down after dinner and he'd crack the books till, late at night, trying to figure out what was wrong with Mrs. Smith or Mr. Jones. And I thought I just was in awe of this guy. And so I thought, I'm going to do that. So that was my main core idea that I had as a young person and growing up. And then I also was very athletic as a kid. So growing up, so I burned off a lot of my energy getting heavily involved in martial arts. And I saw that as an art and a profession. And soon after that, going to college, I didn't necessarily love college, but I loved learning. I loved the academics involved around biology and those kind of, I would say, chemistry. I enjoyed that, mathematics, etc. So I had a proclivity to enjoy those, to be involved in those, and to also, I was intrigued by them. And so as a result, I continued on, and I thought, well, I'm going to go to medical school. So I started pre-med at Creighton University in 1980. And, back in 1976, I went to Creighton University to do pre-med. And as I was studying along, I was teaching martial arts at the same time. And I'm watching all my friends, they're in medical school, and their time is, now they're going to the hospital, now they're studying. And, this is the time where a lot of the physicians had rounds. And I thought, how am I going to teach martial arts and do this as I get older? So I'm looking, and I love working with my hands. I like sculpting and things like that. So I decided I'm going to go check out what else I could do. And so a friend of mine said, why don't you check out the dental school? So I walked down, looked around, and I thought, I never really thought about dentistry, but you do get to sculpt and do artistry and all these kind of things. So I enrolled in that, and, here we are, 40 years later.
Very interesting. I'll tell you, funny, because I had a similar initiation. I initially thought about medical school and ended up in dental school. And they were still saying, well, let's see. But by the time I got into the clinic, I was at a very progressive school. we got in the first year, and I started working on people in the first group that went in, and I said, wow, this is amazing, and I've loved it ever since. And, you know, I want to ask you a question, because we're both dentists, but for the audience, what is biomimetic and holistic dentistry mean?
Okay, so biomimetic is basically a technology in rebuilding the teeth in layers, just like Mother Nature. And let me just break down the word itself. Biomimetic comes from bio, which means life, and mimetic, which means copying. So it's those principles that are copying life. And in dentistry, for example, we can take the whole tooth apart in all of its layers, and then by understanding the principles and the mechanics behind each of these different layers and their purpose to function in a person's mouth, tooth by tooth, or collectively, we study that from a dental engineering viewpoint. That's a biomimetic dentist. So how, if a tooth breaks down, how are we now going to build it up, especially with the advent of what's called adhesive dentistry or bonded dentistry? Exactly. There's so many things we can do, whereas before, when you or I were in school, everything we had to grind and whittle everything down and stick crowns over everything. And I mean, that was a tool we had at the time. But with biomimetic dentistry and minimally invasive dentistry, we can just clean out the decayed area and rebuild that portion of the tooth back up, maybe lay some porcelain over it for strength, and, you know, walk away. And we've not destroyed a whole good portion of the tooth. We've kept the nerve healthy. Now, that's biomimetic dentistry. So biomimetic dentistry works off of, there's 169 studies and peer-reviewed articles that you get trained in, you go over. We've culled them down now. Maybe there's 69, but we're familiar with all this peer-reviewed technology that explains to us the dental anatomy and the dental mechanics of each layer within the tooth, how they function, how they coordinate one, that, for example, the enamel, the hard outer surface with the inner dentin, all the way down to the nerve. How do these things function? And it turns out they're living, breathing particles or systems within our own body. And that's how they grew from little tiny buds into teeth. There was a pathway through nerves and blood supply, nourishment, etc., for those listening that are not dentists. And so I found that very fascinating. Now, before I started doing that, though, I got into holistic dentistry. Now, holistic dentistry is basically, okay, the teeth are connected to the mouth, and, you know, what's going on with the body? Is there a relationship there? And sure enough, there's quite a heavy relationship, which, you know, now we're reading about. If you have gum disease, you have a higher risk of cardiovascular, heart troubles, circulatory troubles, you know, the dementia. There's a lot of connections there. So basically, keep the mouth super healthy. Let's avoid infections in the jawbone. And then lo and behold, the body actually functions better. That's part and parcel of holistic dentistry. And then also, what materials are we going to be using? Are they as safe as we know for the human body? You know, most of the holistic dentists now, it's a big controversy. It's never been for us as holistic docs. We don't use fluoride, don't really believe in the concept of fluoride because we know that it's now known as a neurotoxin. So, well, okay, but isn't it better if we can find a substitute? And yes, now we have alternatives. We have alternatives to these materials that we've used for 175 years. And thank goodness, we don't have to stay stuck in a rut and go, well, if it was good enough for my grandfather who was a dentist and his grandfather, well, golly, it's got to be good enough for me. You know, let's stick that mercury filling down in there again. You know, so we just have alternative materials now. We have alternative procedures. And if we stay within the holistic bucket, we're going to be doing things that are healthy for the body. If we follow biomimetic principles, we're going to rebuild teeth from the standpoint of as close to Mother Nature as possible, minimally invasively. And it's just a win-win for everybody, in my opinion and my observation, doing biomimetic dentistry for the last 14 years, actually now 15 years. So what a blast.
Well, absolutely, it makes total sense. And you mentioned about inflammation and disease, which is so true, and how you're helping people to avoid that. And you know, you've completed so much work in your career, over 10,000 veneers, all these full mouth reconstructions where you put people back together and they can smile again. I wanted to ask you, so the viewers could get this, is how do you decide, what is the process you go through on how you plan for each different patient?
Well, that's a great question. You know, it's sort of a coming together of many different little teachings and philosophies, you know, from some of my mentors, which I won't throw out there because a lot of the people listening are not dentists. But let's just say what I did is I studied from, if we're going to do a full mouth reconstruction, well, let me back up a little bit. When I first started in West Texas, so many people had terribly bad teeth, decayed, missing teeth. The kids would come in, they're 18 years old. They've been doing methamphetamines. They've been doing so many drugs. They've ruined their teeth with massive sugar and depletion of nutrients and things like that. So I had my own denture lab there, which I could make dentures in one day, which was very convenient for this type of clientele, et cetera. But I had a lot of people coming in. They had some bad teeth, but I could fix them. But what was going to be the best way to fix them? So I started doing the traditional caps and crowns and bridges and things like that. And after 8 or 9 years, I would see they were doing great, but sometimes one here would fail, something here would fail. So I kept going, all right, there must be a better way to do things. And so I took a tremendous amount of continuing education on how to rebuild bites. Now, fortunately, I got a lot of on the ground training because I had the denture lab. You imagine people come in, you're taking all the teeth out, or they have no teeth, and you have to figure out, where do you put these teeth between the nose and the chin? You know, where are we going to put these things, right? And so we ended up doing so many dentures. You know, I don't even have, I know I've done well over 10,000 dentures in my career. I just did so many. So we're used to sculpting and catching an artistic eye, but all those points can be broken down into various steps. And so what I do in my treatment protocol, I have quite a bit of photography that takes place, of course, x-rays that take place, and then we have about an hour and a half long clinical exam. Now, this is based on a questionnaire, so we find out what the patients want. And I cater to those people that feel they're in a hopeless, impossible situation, like nothing can be done for me. And my great joy is bringing hope to them. And I get so many patients that they're just so happy that I don't have to pull all their teeth, or and one lady was told by 3 different clinics she needed between 10 and 12 root canals. And we were able to rebuild her teeth biomimetically, layer by layer, put some thin porcelain veneers over her teeth, beautiful smile, and no root canals. So, I mean, what a wonderful thing to provide for people. So going back to your question about how do I treatment these things, it's basically these people search me out now, and then I've got a questionnaire that helps me understand what it is that they're really looking for. And then through photography and then scans that we can do, send to the lab workups, etc., we can design exactly where we can rebuild the teeth. And we do it based around phonetics and aesthetics. And it just keeps it really, really simple. And I like things to be simple.
It sounds like a good thing to me. I like that myself. You know, as you speak, I can't help but just say this. I feel like I'm watching this Texas Ranger, like from like a long time ago, and that you come on your horse very calmly, even though you're going very quickly, and just calmly come down, look over the town, and figure out how you're going to fix it. And, you know, it just exudes out of you in a very aesthetic, but it's very interesting, because because you'd probably be the most aesthetic Texas Ranger. Wyatt Earp probably would look up to you. And I couldn't help but say that because I just getting that. It's amazing. I didn't ask you, where were you born?
Chicago. Yeah.
In Chicago. Wow.
Yeah,
okay.
Midwest. We consider it Midwest, Chicago. Yeah.
And how did you end up in Texas? That was just by chance, or?
No. I went to school in Omaha, Nebraska, Creighton University. So a very
Okay.
prestigious Midwestern school, like Notre Dame or something. And we would take trips down to Padre Island, the south part of Texas, usually for spring break. And those girls, they all had blonde hair, and they talked with the, sweet Southern. Oh, how are you? Oh, bless your heart. They were the sweetest things. And I thought, oh my gosh, I'm moving to Texas when I get out of dental school. So I did. I moved to Texas. Unfortunately, I had a brother that lived there in Dallas. So I got to hunker down with him while I went and passed my boards in Houston. And then I started working. I mean, I could have had a horse out there. I started working out in West Texas, San Angelo, Texas, of all places. And, there's a famous show on right now with Billy Bob Thornton, The Landman. It's Landman, and it's out in West Texas. Now, when I watched that show, that's my old stomping ground out there. I was out there for 14 years. And I'm like, oh, yeah, I've been over there. I see that place over there. And we had all that stuff going on. And, Texas, I'll tell you what, my upbringing in dentistry was so great because I went to West Texas. People had really high need for getting their teeth fixed. We had a lower fee clinic. I got to really learn so much right off the bat. And they were some of the most wonderful people in the world. They would actually come in and I would go over a treatment with them and I'd say, what do you think? And they'd look at me funny, like, well, you're the doctor. Let's get going,
Exactly.
That was great. Now I'm in, California, and everybody's an engineer or something, right? Or, they're working for NASA and they want everything broken down molecule by molecule, which is okay. But it was a different time and different mindset.
That's totally right. And then you were on this show on television, and here you are working on people live on television. I mean, that's got to take some amount of serenity, comfort level, courageousness. How did it impact you, and how did it change the person that you are, or did it change it?
Well, at first you're nervously excited because you want to do well. It's a reality TV show, 10 years younger, and but when it came right down to it, you're basically having a relationship with one of the patients that's been screened, and you sit down and talk to them and have an interview. So it became very natural after a while doing that. And the TV and the camera crew, they work with you too. They're like, okay, bring your energy up. Okay, do this. All right, now let's do this again. Now walk in there again, So they really work with you and make you look really good. But where the rubber meets the road, honestly, is that relationship still is with the patient, because when the camera crew leaves, I'm still taking care of the patient, getting everything ready for the big reveal. And when the big reveal happens, we have a time frame, like, all right, well, we're coming back in a week and a half, and you got to have everything done. So it's a commitment, and it's basically an agreement with these patients. And so there's a lot of charitable work in some of these projects as well. So, yeah, I mean, it was a blast, honestly. I'd do it again.
Amazing. Well, congratulations to you for doing it. I think it's quite amazing. And, I wanted to cover something because I know probably a lot of people are very curious, because you do this smart technique for removing silver, or what we call amalgam fillings in dentistry. Why do you feel this is important as a treatment?
Well, when a person really studies the history of the mercury and the silver filling, amalgam, mercury filling, silver filling, there's all kinds of euphemisms for it. Number one, I always refer to it as a mercury filling, because you would call a component, whatever the material you're using, we would typically call it by its predominant material within it. So if it was a gold crown, it's mostly gold. There might be some tin and so there's some silver or palladium in it or something. So with mercury, it's by weight 45 to 55% of that silver filling. And so somehow it got blocked, and we know how. I mean, it just happened over a period of time. It became this euphemism. Oh no, it's an amalgam. That doesn't sound so bad. An amalgam sounds okay. It's just some stuff, and well, it's black or it's silver. Okay, that doesn't sound so bad. But if you say it's a mercury filling, oh, what happens to the mercury? Oh, well, it stays blocked in there, right? So we all know that in dentistry, dentists my age and older, I don't know if they still teach that at the schools now, but it was taught forever and ever that it would get locked in there. Those mercury vapors stay there. So mercury has the uncanny ability to be a liquid, a vapor, and a solid at room temperature. So it's always got some vapors coming off. And the problem is that, well, where's it going when it's in the mouth? How is it absorbed? Where does it go in the body? And is associated with making people sick, having chronic exposure, etc. Whole different subject. But the reason I got involved in all this is I had a patient who was kind of sick, and he said, do you think that the root canals you did on me could have caused my kidney troubles? And I said, geez, it's back in 1995. I said, geez, I don't know. I don't think so, but you know, I'll do some research. So I called Hal Huggins. He was a pioneer of, let's say, mercury safe removal protocols and biocompatible dentistry and using safe materials, etc. And you know, he was very outspoken, had his license taken away. He really got suppressed severely by the hallowed halls of dentistry, let's say. So anyway, I got into that from that, and then I joined a very prestigious group that was had on their board and members. They have medical doctors, they have healthcare professionals from all different avenues of healthcare. They have toxicologists, etc. So I joined this group, and it was the International Academy of Oral Medicine and Toxicology. And I remained a member in this group because their whole mantra is show me the science. Now, when you look at the science behind the mercury and the amount coming off through all the research done through these organizations and many, many others, if you were to stack papers from the floor on as high as you could of the amount of science that shows the mercury comes out, it goes all through the body. I'm not saying it directly causes this illness or this illness, but it for sure messes with the immune system because glutathione in our body tries to take it out. If glutathione's not there to work on other factors happening in the body, then it opens the avenue for other problems. So by association, there can be trouble. So when I started seeing all these things, and you stack up all these papers, they go all the way up almost to, you know, a 10-story building. And then the American Dental Association has a stack about like this. Wow. What's your science? Well, they've been around for 150 years, and they're not making anyone more sick in that group than it is in this group or something like that. So I thought, okay, what happened is then it became a hot debate, and it became a religious debate. And what do you believe? And do you believe this? And do you believe that? I said, I don't believe nothing. I want to see what's the science showing on this. And lo and behold, when I saw the science behind it, I said, oh, wow, I need to not only protect my patients, but I got to protect myself and my staff. So the protocols were there, right? Wow. And then
so, you know, I'm sorry to have to interrupt you. We've had such a great time. And as what happens when something is so important and wonderful, it's flown by. And you know what I realized, though, that we have to have another show, part 2, with Dr. Paul O'Malley. And we're going to have to continue this because you were right in the middle of something with the mercury, but I can see that we're leading into something that I don't want to cut it short, but definitely I can see why you're removing it. A very interesting topic, probably very controversial still, even today.
Still kind
right?
And I can do this to the people that are listening out there, you know, not to freak out by it and all that. Just make sure if you're having it removed, your dentist gives you some oxygen, puts a rubber dam on, and keeps you protected that way. that'll go a long way to protect you. And at some point in another show, we'll talk about what the dentists can do to protect themselves, because we're breathing it all day in and out.
Well, absolutely. I think we need to have that show. And I can see that your viewpoint, your mission is much broader than the like, well, this is what's been done forever, so we're just doing it because it works and blah, blah, blah. So you know what? I wanted to thank you for being on the show.
Oh, my pleasure. Thanks for having me. And I hope we can do it more. There's a lot of cool things happening out there. I appreciate it.
Absolutely. And if anybody's looking for Texas Ranger also, now I know who to call, and I'll see if I can hang out with you. Thank you so much, Dr. O'Malley.
Dr. Fialkoff, thank you so much for having me on the show.
It's a pleasure. I've had a blast. We're going to have more, so stay tuned, and I will have Dr. O'Malley back. But for tonight, unfortunately, we have to end the show. We'll see you on the next episode of A Time for Truth show. Be well.
This show was sponsored by Atimefortruthfoundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet